Hello and welcome to Medical Today. I'm Jared Ratnam. This is episode 4 of season 3.0. I tell you what, we've got a great show coming your way. Later on today, we're going to be taking a look at gastroenterology. What about gastroenterology are we looking at? We'll be looking at endoscopy, or the scope that goes through you, what the technology is, how it's moved forward, and how it can save lives. Also on the show, we'll be showing you a little something, a video with regards to putting on a Band-Aid, or as we know it here in Malaysia, plasters, how to use them. We're going to be taking a look at that later on in the show. But first, we want to talk about UV and eyewear protection. And joining me in the studio is Azizah, or Azizah Ismail. She is the Malaysian Optical Council Secretary. And also joining her in the studio is Chong Professional Affairs Executive for Malaysian Hoya Lens Sendirian Berhad. They've joined us to talk about, of course, the eyes and UV and eyewear protection. Ladies, welcome to the show. Thank you very much for joining us on episode 4 of Medical Today. Now, when we talk about the eyes or ultraviolet exposure, it is becoming a bigger problem. Why is it becoming a bigger problem, especially in tropical countries?
Yeah, as we all know that our ozone layer is getting thinner and thinner now, and we are living in a tropical country where we receive a lot of sunlight. If we work outdoors a lot, so we are exposed to UV light. And this UV light can cause a lot of damage to our eyes if we do not protect our eyes.
So when you say UV light can cause a lot of damage to our eyes, it's getting worse as we speak because the ozone is thinning. But I think the bigger question is, what kind of eye problems are we seeing, say in Malaysia, Singapore, Indonesia? We're seeing eye problems. What kind of eye problems are we seeing?
Short term, we can have conjunctivitis or photokeratitis, whereby the outer layer of our eyes is affected. But long term, we can get cataract. I think everybody knows cataract, where our lens get opacification because of long term of exposure to the UV light. Right. And along our lives, when we expose a lot, we can get macular degeneration. Cataract, we are not so worried. We can always do cataract operation and put implant, and you can see again better. But as for macular degeneration, it's irreversible.
Okay, for those of us who don't know what macular degeneration is, maybe you can just walk us through what macular degeneration is.
Okay, we see clearly with our retina, okay, where all the nerves are for us to see clearly. The nerves will send all the neurons will send all the images to the brain for us to tell us what we are seeing. But when the nerves is damaged due to UV light, and then your eyes will become blind. You can become blind if you're overexposed to UV light. Yes. Now, I guess this is where you come into the conversation, Ms. Chong. When we talk about exposure to UV rays, I think the thing that comes to mind is proper lenses. Now, what is a proper lens, or what are proper lenses?
Okay, so normally for all the lenses, no matter it's the clear lens or the sunglasses, okay, the very important point is to make sure they have 100% of UV protection for UVA and UVB. Okay.
Okay, hang on there. You say UVA and UVB. What's the difference?
Okay, so when we're talking about UV, okay, first of all, we have to understand the electromagnetic spectrum. Okay, so we have visible light in the middle, and UV actually have the shorter wavelength than visible light. So UV is so-called invisible. UV is something that we cannot see. It's not a kind of light, it's a radiation. Okay, so UV, they have 3 categories. We have UVA, UVB, and UVC. UVC are the radiation that come with the shortest of wavelength, means the highest of the energy.
Shortest of wavelength, but the highest of energies. Yeah. Okay.
Yeah. So actually, it will be the most harmful one among 3 of them. Okay, but fortunately, our ozone layer, it helps to block all the UVC. And then when we're talking about UVB, it's slightly lower energy than UVC. Okay, so ozone layer definitely help to block partially, but when it reach our light, our eyes, okay, it will block by our front part of eyes, including your cornea and the lenses. Okay, so a low amount of UVB, it can stimulate our skin pigment, the melanin. So that's why when we get the UV exposure, your skin will get darker. Okay, so this UVB, it will absorb by our lenses and cornea. That's why, like what Azizah mentioned just now, we will have the cataract when we have the long time exposure for the UVB. And then the next one will be UVA. Okay, the longest wavelength among these 3 UVA and B and C. Okay, so the energy definitely will be the lowest one. Okay, so it
longest wavelength, lower energy. Okay.
Yes, so it can pass through the lenses and reach the macula, and it will cause the macular degeneration. Yep.
Now that we know what we know, and we also know, like you mentioned earlier, that the ozone layer is thinning. Some of us think it's just something that we can prolong by not doing anything about, just leave it be, but it is already affecting our eyes. The Malaysian Optical Council, what kind of studies or data do you try to get within the council?
Basically, Malaysian Optical Council is dealing with registration of practitioner, optometry practitioner. So this is through my learning when I was in university and what we practice as an optometrist. Okay, so what we want to emphasize most is to inculcate a culture to the public so that they started to wear sunglasses.
Right. See, my friend, I've got a friend who is working in the background now. His name is Sam, and Sam's always right when he says, get proper sunglasses. He always says, if you're going to buy the sunglasses, get a proper pair of sunglasses. Now, when you say a proper pair of glasses, let's talk about glasses. What's good glasses and what's bad glasses?
The good glasses, definitely the lenses come with UV protection, because some sunglasses in the market.
No, okay, you said the lenses come with proper protection. You go to Pasar Malam, they are saying come with proper protection also. Say, ini UV bagus mia, ini boleh beli.
Yeah, but Jerry must remember, good things always not cheap. If you find cheap things, normally it's not good. You won't know, because why? If they claim that it has UV protection and you wear it, you know what happens if you wear dark glasses, your pupil get dilated. When your pupil get dilated and you don't have UV protection, all the UV light will come in excessively comparing when you're not wearing sunglasses. Because when you're not wearing sunglasses, your pupil will constrict. So the amount of light that come in, or the amount of UV radiation that come in, is lesser compared to when you're wearing dark sunglasses with no UV protection. It makes things worse.
Right.
Yeah. So who you want to trust, the Pasar Malam or the branded ones?
See, the thing is, everyone's buying things online also now, and online they'll say, oh, this is UV safe, this is good for you, so on and so forth. So now if I'm going to buy a pair of sunglasses, how do I know that these lenses are, when they tell me, okay, even if I go to an optometrist and the optometrist says, this has got a great UV protection factor, you must buy this. So how can I check?
Normally there are some devices that can check the UV, okay, but like Puan Azizah say, sometimes we will judge it by the prices, by the brand. So definitely that will be one of the method that we can choose a better sunglasses. So at least get for a good sunglasses, normally they will start with few hundred ringgit onwards.
Right.
So if you get something like 10 ringgit per pair, 20 ringgit per pair, so definitely it doesn't count with the
or
UV
300-400
protection.
ringgit definitely doesn't have enough UV protection. So now what's a polarized pair of sunglasses? Well, what are polarized glasses?
Okay, polarized lenses is very popular among the outdoor lover. Okay, especially for those that like to fishing. Okay, they have a lot of water sport. They would like to choose the sunglasses come with the polarized. Okay, so polarized lenses are the lenses that help to cut off a lot of glare. Okay, because normal, I mean, as a regular tinted glasses, okay, it only reduce the brightness and maybe enhance the color contrast. That's all. But for some harsh glare, it have to use polarized lenses. So the concept of polarized lenses is just like you just imagine the window blind.
Right.
Yeah, the window blind. Because polarized lenses, there is a chemical treatment. Okay, all the chemical molecule it will line up vertically. Okay, it's just like our window blind. Okay, the light will only pass through the blind opening. Okay, so these polarized lenses is the same concept. It's a filter. So it will allow the vertical light pass through only and block all the horizontal glare.
Right.
So your vision will become sharper and more crispy.
Right.
I mean,
okay,
crisper.
of course, the next question I'm going to ask is not in the list of questions, but a lot of people are talking about glasses for driving, especially during the night and for twilight, where when the sun is just going down. They've got special glasses for that. Do these glasses work? Do these glasses also cut glare?
Yes. Okay. Because in the market there's a lot of like driving lenses. Okay, they're target for people that having some problem when they're driving, especially the glare. Okay, so for all of these lenses that can try to absorb or reflect the blue light, that are the main problem for the glare. Okay, so with this kind of treatment, okay, definitely it will enhance the color contrast and help to reduce the glare.
Right. Yeah. Now, the next batch of people that we are very concerned about are children. You know, children are now wearing glasses at a very young age, but they're also, when you talk about exposure to UV rays, kids are out in the sun playing. So what would be the advice for children? Maybe Azizah, you can start first, and Chingwei, you can continue. Yeah.
Okay. As for children, if they are wearing glasses for refractive error, correcting their short-sightedness, they can just wear glasses that have UV protection or multi-coating and whatnot. As for the one who is not wearing glasses, they can always use, we can teach our children to start to use sunglasses. Actually, sunglasses is not only for cosmetic reason, but there's a purpose behind it.
But kids need to be trained, and put it on, and they'll be like, oh no.
Yeah,
no.
you'll be surprised. They like it.
They like it
because
wow.
they look.
Oh, they look cool.
Yeah,
they want to look cool.
Yeah.
Now with
it's a trend now.
with sunglass technology, so because we know kids like to throw things around, they like to always experiment, right? So are sunglasses made for children, proper sunglasses where they're more durable, so to speak?
Yeah, definitely. In terms of like frame material, there are some special material. It will be more flexible, and then certain lenses, we call it like high impact lenses, the triware lenses or polycarbonate lenses. Okay, it will be high impact. So it's definitely special design for the kids.
Now, when you wear sunglasses, Azizah, coming back to you, some of us wear sunglasses, but we still squint, with the sunglasses on. Why do you think that's happening?
Yeah, because there's still amount of light that can cause glare to our eyes, even if we are wearing sunglasses. That's why choosing of a good sunglasses is very important. That goes choose the branded one, you see,
right.
And the best is the polarized glasses. It's a little bit expensive, but it's worth it.
Okay, so now if I'm going out to get myself a pair of sunglasses, I need to make sure it's polarized. I need to make sure it is of a good brand, because with the good brand you get good lenses,
Yes,
right?
yeah.
And what else am I looking for? Chingwei?
I mean, this will be the main two factor.
And the main two factors, yeah.
Yep. Other than that, sometimes you will choose like the sunglasses shape that match your face, the color.
The size make a difference.
The size, yeah. Regarding the size, because see, when the UV light hit your skin, you age earlier. So that's why you need to wear bigger
so I need one big glass.
not that big, just a bigger one, so that it protects around your eyes, so that you won't age earlier.
Right. So it's true why women like wearing bigger sunglasses, because it helps with skin protection too. Now I'm also guessing that with what we're talking about, there are a sector of people or a segment of people that refuse to wear sunglasses now. You know, what would be your advice to those of us who don't like wearing sunglasses?
There's no other options,
no
isn't it?
other options now?
Unless you want to wear hat with a big
like the Korean ladies walking around KL shopping.
But it's not our culture to wear hats like that, unless we are by the beach side or what. I think sunglasses is the best. Invest in a good sunglasses. It will protect your eyes for long term. Save your eyes from cataract, because as an optometrist working in hospitals before, it's quite scary for me seeing people undergo cataract operation. You see, I mean, you see every day people going for cataract operation. It's nothing to worry, but it's for myself, it's a phobia.
Yeah, so you've developed this phobia seeing people coming in for operations.
So it's better, prevention is better than cure.
Right. Now, with sunglasses too, I mean, we're paying a lot of money for it. The other excuse you always hear people come up with is, you know, you buy a pair of sunglasses, if you lose it, you know, your money is gone, you know, like. So people are afraid to invest in sunglasses because they're afraid they'll lose it. So, you know, like, have you heard of things like this? And what would be your advice about not losing things, I guess?
Okay, actually, other than sunglasses, when you're wearing the contact lens, try to get the contact lens with the UV protection. When you get a pair of clear glasses, I mean the clear spectacles, make sure the lens comes with the UV protection. And then when you're outdoor, okay, try to get the sunglasses, but make sure you keep it well, definitely.
Right, you can't just hang it around your neck, huh?
If you accept it, definitely you can hang it.
Right.
But in terms of cosmetic, maybe it's not really nice.
So to have more than one.
Try to have, here's the trick. See, they're trying to sell us something now. Try to have more than one pair. That's what they're saying.
So you have 3 cars in your house, put all 3 cars, one sunglasses.
That's very good. So at least keep about 1,500 ringgit to buy 3 pairs of sunglasses. Now, before we let you go, very quickly, let's talk about steps that we can take in order to lower your risk of eye disease and vision loss. We already spoke about it. Let's just go through these steps again, okay? So you don't want to develop eye disease or the loss of vision. What do we do?
Okay, whoever who is working in a long, exposed to the sunlight for a very long time, especially policemen, anybody who's working in the farm and whatnot, where they exposed to sunlight quite a long time, every day, they need to wear eye protection.
Right.
So that one is for the long term measures that we can do. But after 40 years old, you need to have a yearly eye checkup to ensure that you don't have any eye problem, because eye disease, normally they are what we call silent thief of the eye, because you don't feel pain, you feel nothing, suddenly you go blind.
Right. So after 40, make sure you go for an eye test.
Normally it's 40 lah. We benchmark
at 40.
Unless you have diabetic at early age, then that one you have to go for checkup earlier.
So I mean the gold standard is by the time you reach 40, start going for eye tests. For me, that's not a problem. I'm only 25 this year. Now
come same with me.
Yeah, same 25.
Yeah.
Okay, I thought you were 26. But Chingwei, we're going to ask you one more question.
Yes.
So some tips for choosing the right color for lenses.
Okay, first of all, I mean, most of the consumer, okay, you will choose the color based on the design of the frame, which color that I liked. But I can say the most common color, like in the market, it will be gray, brown, and then some yellow and green. Okay, that will be the few popular color. So, for example, like gray color, okay, it will be the darkest tint available, okay, and it does help to cut off the glare and provide you a natural color perception.
Right.
Okay, and for brown color sunglasses, okay, it more focused on enhance the contrast. When you're on the brown color or something like yellow color sunglasses, you will find that the contrast, it will become better.
Right. One last question. Some people wear reflective sunglasses. Are that only made for gangsters or? Yeah.
Not really for gangster only. Okay, for those people that like fashion, normally they will get a pair of like the mirror lenses.
Right. So the mirror lenses are just for fashion and to make yourself look.
But actually, for the mirror lens, it will reflect more light compared to the normal sunglasses.
Right. Right.
Yeah. But in terms of handling, then you have to be extra care because normally for the mirror lenses, when there is a scratches, it can be very obvious.
Right. So on that note, I'd like to thank both you ladies. I'd like to thank Puan Azizah, Secretary of the Malaysian Optical Council, and also Ms. Chong Wei, the Professional Affairs Executive from Malaysian Hoya Lens in Riyadh Berhad. Thank you so much for coming in to share with us some tips with regards to how to choose a proper pair of sunglasses and why you need to protect your eyes from UV rays. When we come back, we'll bring you more right here on Medical Today. Stay with us. I'm Jared Ratnam.
If you look around you, joy is pretty much everywhere. Your favorite TV shows, your best friends, your favorite selfie. See? Joy. Now try looking at them again with Hoya Sync 3. All the vibrant colors are now in full detail for a clearer focus on the moments that matter. At any angle, wherever you are, magnified, true to your needs. That's happiness without a strain, and it's yours for as long as you have it on sight. Because your eyes are not made for screens. Sync 3 lenses are Hoya, Eye for Detail.
Hello and welcome back to Medical Today with me, Gerard Ratnam. As always, if you're looking for information with regards to eye health and eye care, go down to www.hoya.com.my. From there, we take a look at a scope, or it's better known as endoscopy. Well, our host Nurata Amin had the chance to get into the scene of where the action's happening. Well, she was there to witness a scope happen, and she did speak to Dr. Ahmad Shukri bin Muhammad Salleh. He's a consultant physician and gastroenterologist, hepatologist, and he spoke extensively with regards to what a scope is, and he also gave us a 101 on how it's done. Well, we have a very interesting interview with Nurata handling it on site. Let's take a look at that interview right now.
Welcome to Medical Today 3.0, Datuk. Thank you for joining us.
Thank you.
All right. Endoscopy is now widely used for many health screenings on health-related issues. So what is endoscopy and what makes it different from other diagnostic tests such as ultrasonography and X-rays?
Right, okay, thank you so much, Atta, for the questions. It's very interesting. Endoscopy is the equipment that we use. Endoscopy is a procedure that we use the scope or endoscope to examine the internal organ. This whole organ, like esophagus, stomach, they are filled by gas. And ultrasonography cannot see much inside the organ, but it's good for solid organ. And the X-ray we see the, for example, the chest, the lungs, and but not good for the stomach or the intestinal.
Right.
And endoscopy, the procedure where we use the scope with the camera at the tip of it. So we insert through the hollow organ and we see directly inside the organ. For example, upper GI endoscopy, we look inside the esophagus, the stomach, and the first two parts of the duodenum. And colonoscopy, we examine the colon. So the visualization of the inner organ very, very accurate and well seen by endoscopy procedures.
Right. Now let's move on to heartburn and reflux.
Yes.
So as we know, heartburn and reflux are so rampant among Malaysians nowadays. So what are the causes?
Right, it's very interesting. If you noted that Malaysia is the highest rate of obesity. So obesity, overweight, is one of the cause of reflux. And beside that, smoking, alcohol, coffee, pregnancy, and this is among the causes of reflux. When the acid from the stomach, it goes up inside into the esophagus, and patient might come with heartburn, with symptoms of reflux. Reflux by itself quite common, but to have the symptoms of heartburn, that makes the patient come to see doctor to seek for treatment.
So what are the symptoms of heartburn and reflux?
Right. There are few alarming symptoms like difficulty in swallowing comes together with that, vomiting out blood, loss of appetite, loss of weight. This is more alarming symptoms that if that comes together with the reflux, that need further investigations.
Right.
Yeah.
So now we're going to talk about colon cancer, which is the main issue here, which is one of the most common causes of cancer-related death. So what are the symptoms of colon cancer, doctor?
Well, thank you, Etta, for asking that question. I think colon cancer is very, very important for everyone to understand, because colon cancer is highest cancer among men, and the second after breast cancer in women. So what are the symptoms of colon cancer is that the early cancer does not present much symptoms, but those who have symptoms, they come with bleeding from the rectum, we call it rectal bleeding, where the pus moisture is all blood there. And number two, change in bowel habit, or they call it altered bowel habit. Meaning to say that someone who opened the bowels once a day, but they notice lately the bowels become more frequent or become constipated. These are the change in bowel habit. And the other symptoms like abdominal pain, discomfort for no reasons, and then for a few weeks, things like that, without any reason. And number four, other symptoms like loss of appetite, loss of weight. And that's normally quite the late stage of cancer when that comes into loss of appetite and loss of weight. And that's about the colon cancer we're talking about just now. But the most important is that how are we going to prevent the cancer of colon cancer? Because there are many cancers, but not many cancers that can be prevented, can be treated, can be cured. Yeah, colon cancer is a cancer that we can prevent it to happen, and we can treat, we can cure, providing we follow a few guidelines. Yeah, number one, we have the screening of colon cancer by doing few methods that will help to pick up early polyps, which can turn into cancer. So by detecting the early polyps, we can remove the polyps and that prevent from cancer. And number two, if someone has cancer and that can be investigated and treated by endoscopically or surgery, that also can cure the cancer. So colon cancer is one of the cancers that we have something to offer in terms of detecting the early changes or polyps.
All right. Following to that, doctor, is it true feces with its colors and shapes could determine that you had cancer?
Right, that's good questions. There are a few signs from the feces. Number one is that the color, if the feces come with the blood, obviously is abnormal. Sometimes you don't see that fresh red blood, but rather blackish stool. Means the blood has mixed with the stool and came out as, we call it melena. That's indicate bleeding high up, you know, maybe the first part of the colon or in the stomach. Yeah, and number three is that some of the bleeding you don't see on naked eye, but you need to send to the lab to analyze the stool. They call it fecal occult blood test. Okay, and as mentioned about the shape, there's about 7 types of stool shapes by Bristol-Glasgow criteria. Right. You can have sometimes the palette-like stool or the hard small stool, and toothpaste and mushroom-like, you know, watery. So these are the type of stool that indicating there's some problem in the colon. Okay, especially if this happened in recent without reason for that. Okay, compared to someone who used to have the same shape, that's not so bad. But suddenly the shape of the stool changed from hard now become loose, watery. Then it's something that you have to find out why.
Right, which is visit the doctor.
Exactly.
Right, and following to that as well, is colonoscopy is colonoscopy one of the recommended procedures for detecting colon cancer, and how accurate is it, doctor?
Right, it's a good question that because many people come ask us with some blood test of cancer, you know. Doing the blood test for cancer actually is not recommended because you can have high false positive, false negative. Mean to say, abnormal does not mean you have cancer. Normal does not mean you don't have cancer. So it's not good test for cancer. For colon cancer, another test you can do is stool test I mentioned earlier, fecal occult blood test, where there's test kit that the public can use and take the small sample or stool and do it themselves or send to the lab. They can analyze any blood in the stool. If there's any blood in the stool indicating there's some bleeding somewhere in the colon, that need to see doctor for endoscopy, colonoscopy I mean, yeah. And another test is CT scan, we call it CT colonography. Instead of CT scan looking for the organ, but this CT scan looking in the colon, yeah. That also could be done, but that involves radiations, okay. And if you see something abnormal, you can't do anything because you can't take biopsy, thing like that, you cannot sample. But that's why colonoscopy is more preferable because it's more accurate. You can visualize the colon. Any abnormality, you can take biopsy. Any polyp, you can remove straight away. Yeah? And it's more accurate. But of course, there is some risk of doing colonoscopy compared to other procedures, but the risk is minimal and small. But again, doing colonoscopy is not the answer for all, because sometimes colonoscopy can turn out to be normal, but patient found to have cancer over 1 or 2 years. The reason for this, one or few reasons. Number one, the procedure was not done complete because of some reason or another. For example, the bowel preparation on the right side was not clean, so visualization of the right colon was not well seen. So polyp can just miss underneath the fecal material. Number two, the visualization of the colon itself. Most of the scope they have the view for 170 degree, where they can see the colon at 170 degree. So there's limitation on that because the rate of missing polyp behind the fold quite high, talking about 20-30% of missing polyp. And that's why the system that we use here is a full spectrum endoscopy, where our system using the scope with 330 degree coverage views. So we have 3 cameras to look right and left and at the center, like you're driving, you have blind spot. So by having the right and left mirror, that to avoid the blind spot, isn't it? So by having the 3 camera, the view can cover the polyps behind the fold very well. So that reduced the missing polyp by about 7%. So colonoscopy is very good procedures for detection, but providing we cover all this area mentioned earlier.
All right. So this is what you have in KPJ.
Yes.
Specialist hospital.
Yes.
All right. I'm interested in knowing also about what would you recommend in terms of the next follow-up for the patients after going through colonoscopy.
Right. Depending on the findings of colonoscopy, if the finding was normal, that's all right. Just follow up the assurance and treat the symptoms. But if histology turned out to be adenomatous polyps, and there's a few types or grading of adenomatous polyp, then depending on what kind of adenomatous polyp we're dealing with, then we advise patient accordingly. And we advise patient to come back at least another year to do the full colonoscopy after the first one if the polyps turned out to be adenomatous polyp, because the adenomatous polyp can turn into cancer. But majority of the polyp is not adenomatous polyp, it's rather hyperplastic. That's okay. So in general, those patients after the colonoscopy, they need to come back to the doctor maybe a week or 2 weeks time to revise together with the patient about the symptoms, about the findings, and take it from there.
Right. Okay. So doctor, I hope we didn't buy much of your time, because I heard you have an appointment with a few patients after this.
Yes. In fact, I have a patient waiting for me for the endoscopy. If you'd like to join me to see the real endoscopy of our patient.
Right. Will be our first experience. Let's go.
Let's go.
All right, currently we are in scope room 1, and I'm with Dr. Ahmad Shukri, performing an endoscopy on his patients. So, doctor, when and why did you decide this gentleman needs upper GI endoscopy or colonoscopy?
Right. This gentleman came to visit me last week. He complained of discomfort in the upper abdomen, and this has been going on for quite a while, which is not responding with normal medications. So we want to assess whether this patient having ulcer in the stomach or having infection called Helicobacter pylori. So this procedure, we call it OGDS, esophageal gastroenterologist, or they call it upper GI endoscopy. So here, shall I explain to you a bit about this procedure? Yeah. So at the moment we are in the stomach. I try to clear some of the secretions so that we have better views. And this is the pylorus. Behind this pylorus is duodenum, the small bowel, part of small bowel, and we are in the stomach now. So I try to get a better view and clear all the secretion first before we go further. Okay.
So this is still the upper GI.
It is still upper GI. We have passed through the esophagus. Now we are in the stomach, and go through the pylorus and getting into the duodenum. This is the first part of duodenum or small bowel. Okay, you can see on the left side there's some erosions. You can see there's some inflammation, reddening of the mucosa. Okay, this is the wall of the small bowel, and we go deeper to the second part of the duodenum. Okay, the beauty of this scope, we call it full spectrum endoscopy. They have two cameras for upper GI, so you can see the middle, the lumen of the duodenum, and you can see the side of the duodenum. Especially we're talking about ampulla, where the pancreas juice came from. Up to now, everything looks okay. Mucosa looks smooth. There's no inflammation, and this is the ampulla where the secretion for the pancreas comes. looks pretty normal in the duodenum, and we try to look for once more. Okay, this is also some abnormal here, where the tissue looks a bit swollen compared to the rest of the duodenum. So we can take some sample biopsy from here to send to the lab to find out why this tissue is a bit abnormal. So biopsy, please. So we're going to take just as 2 bites from here and send it to the lab for details.
So how does this endoscopy, doctor, help in the management of your patients?
Right.
When it comes to the process after diagnosis?
Okay. So by doing the endoscopy examination, we can see directly in the stomach mucosa any ulcer, or any growth, or any cancer, and we can test for the evidence of any infections. If there is evidence of infection, for example, Helicobacter pylori, then we give treatment consists of 2 antibiotics and 1 protoporphyrin inhibitor to treat the infection. So that will help us to treat the cause for the symptoms. The symptoms normally represent something is not right inside there. So the stomach filled by gas, there's no better than endoscopy to look inside the stomach. X-ray wouldn't see that because it's shadowed by gas. Ultrasound also couldn't see that. So endoscopy we see directly. If we see any abnormality, for example, ulcer, or suspect any growth or cancer, we can take sample like we did just now, take biopsy, and send to the lab. So that will help us to treat the whatever causes that we found from the endoscopy examination.
All right. Okay, so how about colonoscopy, doctor? Maybe you can...
Okay, we got to do top colonoscopy when we do the colonoscopy examination. Okay, short one. Okay, we can see here, this is again the stomach. You can see there's small little polyp there. Okay, this is not a real polyp, but due to some inflammation and swelling of the mucosa. Let me just finish this one short while, then we go on the colon. Okay. So again, this is the view in the stomach that we are looking at now. And we're going to test for Helicobacter pylori, which is the germs that can cause ulcer, inflammation, and also can cause gastric cancer. We take 2 bites. Open, please.
Open.
Okay. Close.
Close.
Open.
Open.
Close. So we're finishing the upper endoscopy procedures. Okay, I try to explain on the way back. This is the stomach. We're backward now. We're pulling the scope, and you can see the lining of the stomach wall. Okay, and you can see the stomach here a bit swollen a bit compared to the normal stomach. Some area is atrophic. They mean to say that the mucosa shrunk because of the age. Because some atrophic of the stomach. And here, this patient also have other condition called hiatus hernia. I'm going to talk about it later. And this is the esophagus. Okay, if you can see here, if you can appreciate the difference, you see, I try to highlight with some better resolution, and you can see here the difference. The stomach red in color, and esophagus white in color. The lining of the mucosa. Okay. This is the esophagus, the white in color, and the stomach is red in color. Okay, so in between stomach and esophagus, you can see there's a reddish appearance, called erosions. That means this patient having reflux esophagitis, inflammation of the esophagus due to reflux of acid.
Right.
Okay, this area of erosions just above the junction between esophagus and the stomach. The esophagus is supposed to be white in color, but you can see the linear erosion make it reddish. That due to the acid reflux, which causing inflammation of the lower part of esophagus. We call it reflux esophagitis. Yeah. So
it's the following that we discussed just now. Right?
Yes, exactly. You can see one there, the other one there. You know. So this is very significant, and that also can cause symptoms to the patient of reflux symptoms. Okay. There's no evidence of cancer for this patient. Okay, everything looks otherwise okay.
So this is nowhere near to any alarming stage or signs.
No, there's no. At this age, of course, we always look for any cancer when someone's coming with new symptoms. But this test confirmed that this patient has no cancer involving the stomach esophagus. Okay, just reflux esophagitis. And we put it in the test kit to test for the presence of Helicobacter pylori. If the Helicobacter pylori, the names of the germs present in the stomach, the yellow ring, which change its color, become pink. Okay, so this is the normal one, the green ring. Okay, and here, you think there's some changes there or not? The ring, is the ring start to change the color now?
Right. The second one has changed.
Yeah, the bottom one. This is the normal one. We don't use this is for our control. This is the one that we did just now. You think the ring starting to change their color, or remains yellow? A bit reddish now, isn't it?
In the middle.
Yeah, the ring, the yellow ring start to change its color now, become a bit pinkish. So it means there's a after half an hour we're going to look again. It looks like this patient might have positive results, which indicating that he's having Helicobacter pylori, because you can see the ring, the yellow ring started to have some color there. So what we're going to do? We're going to do colonoscopy, examination of the colon, started from the anus, rectum, and the rest of the colon. So we have a special pants which covered the patient's private part. We only expose during examination only. So this is very important for us talking about the with some privacy to the patient. Okay.
Why are we doing a colonoscopy for this patient currently?
Right. Okay. This patient, we do colonoscopy because this patient has symptoms of altered bowel habit. Mean the bowel habit change from normal becomes loose. Normally, he opened bowel once a day, but last few weeks, he noticed that he started to open more often, loose stool. That call it altered bowel habit. And number two, he's above 50, where the risk of cancer is higher for someone above 50. Number three, he did a test for cancer marker. It was a bit high. So all these factors make the examination colonoscopy is very, very important. Yeah. So this is the part of the colon. You can see the bowel.
Okay, this is one of the special thing that we can see, or one of the advantages using colonoscopy. And Datuk Dr. Ahmad Shukri is removing the polyps. So as mentioned, that these polyps could actually lead to cancer.
It's done.
And it's done. All right, thank you, Datuk Dr. Ahmad Shukri, for spending time with us on Medical today. And it was a such a great lifetime experience for me and for the audience as well. And I think we'll see you again next time. Such a remarkable experience. I'm Nurata Amin, and see you on next episode on Medical Today.
Thank you very much, Nurata. That was Nurata Amin for Medical Today, speaking to Dr. Ahmad Shukri, or Datuk Dr. Ahmad Shukri bin Muhammad Salleh, a consultant physician and a gastroenterologist, hepatologist. Of course, we did witness him working on a patient, and just after that surgery, I'll have you know that that patient walked out in just 2 hours of his surgery with Dr. Ahmad. Very interesting indeed. Thank you once again, Dr. Ahmad, and also Nurata, who conducted the interview. Stay with us right here on Medical Today. We'll be back with more.
If you look around you, joy is pretty much everywhere. Your favorite TV shows, your best friends, your favorite selfie. See? Joy. Now try looking at them again with Hoya Sync 3. All the vibrant colors are now in full detail for a clearer focus on the moments that matter. At any angle, wherever you are, magnified, true to your needs. That's happiness without a strain, and it's yours for as long as you have it on sight. Because your eyes are not made for screens. Sync 3 lenses are Hoya, Eye for Detail.
This is the final segment of episode 4, season 3.0 of Medical Today. As always, in season 3.0, we have a video for you. It's called First Aid Mistakes, and all this season we'll be showing you some interesting things with regards to first aid. Now, this brings us to something very important, a Band-Aid, putting on a Band-Aid. We're used to calling it a plaster. So most of us leave a plaster on, but before we put a plaster on, we always put some cream on and then slap the plaster on. Now, is this the right or wrong thing to do? We've got a very interesting video on how you use a Band-Aid. Let's take a look at that video.
Mistake: leaving an adhesive bandage on a cut. Putting antibacterial ointment on a cut and then leaving on a bandage for a few days doesn't speed healing. Doing this increases unwanted moisture over the cut. Do this instead. Clean the cut and apply ointment, but then let it heal in the fresh air. If you need a bandage to keep the cut clean, change it about twice a day. Also, keep the entire area clean and dry by using gentle soap and water when changing the bandage. But do consult with your doctor as soon as possible to get medical treatment immediately.
Well, that video was really interesting, and it certainly shed light on what you do before you put on a Band-Aid. So if you're going to put ointment on a cut, please do not use a Band-Aid. Let fresh air and sunshine help heal the wound. Speaking of which, we have had a couple of competitions that we ran in the last few weeks, and in episode 2, we asked you for your thoughts on IVF in 2 paragraphs. Congratulations, we have 2 winners. Second prize goes on to Dhanaraj, who takes home 50 ringgit. We'll be sending that to you. Congratulations, Dhanaraj. And also Mr. Abhijay Jayaraj Menon, who sent us 2 paragraphs on what he thinks IVF is, or his thoughts on IVF. Well, he goes home with 100 ringgit. Congratulations to you, my friend. You will receive 100 ringgit coming to you very, very soon. And thank you very much for taking part in the competition and also making things happen for us right here on Medical Today. Well, if you do have any questions for us with regards to doctors or diseases or medicine or anything to do with medical industry or the fraternity at all, please do send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll be more than happy to send you a reply or to try to bring on subject matter experts and, of course, doctors to talk about your favorite topic. So on that note, I'm Jared Ratnam signing off. You have a great day ahead, and also we certainly do hope you have a fantastic week. Bye-bye.
If you look around you, joy is pretty much everywhere. Your favorite TV shows, your best friends, your favorite selfie. See? Joy. Now try looking at them again with Hoya Sync 3. All the vibrant colors are now in full detail for a clearer focus on the moments that matter. At any angle, wherever you are, magnified, true to your needs. That's happiness without a strain, and it's yours for as long as you have it on sight. Because your eyes are not made for screens. Sync 3 lenses are Hoya, eye for detail.